I wanted to share and then talk about some of my thoughts on this poll and this topic of prolapse and when is surgery appropriate. And I will commonly get messages from people asking, when should I consider surgery? I've been trying PT for X amount of months. And my answer always is that it's a very personal decision. One that I hope you have weighed the pros and cons with, and it hasn't been the first thing you jump to. Because in that sense, should something not happen or go well with surgery, you're going to be wondering, what if I would have just done this for a little bit longer? And when you have exhausted your conservative options and you haven't seen that return, and it is at the point where it's impacting your quality of life, then I think you feel really convicted and good about the decision to go forward with the surgery, knowing that you tried as best as you could with conservative management, but it was affecting you enough to make that choice. The other thing I want to consider is that prolapse surgeries have about a 30% failure rate, which isn't low. And if you read some of the studies on it, then their conclusion is, well, even though the surgery failed, the people still had a better quality of life. Like they didn't even notice that it failed somewhat. It's kind of confusing, but either way, when you do conservative management first and you learn proper pressure control, sure, maybe you can't affect your quality enough to change those prolapse symptoms all the time. But if you understand that, that's going to be important for maintaining your surgical integrity so that it does have the best chance of being successful for you. You don't want to go through all of that and then continue with poor habits of pressure control and lifting and bowel movements and such. Because I've seen those people who went straight to surgery and they've exhausted their slings and all these other things that have failed because they've never had anybody talk to them about breathing or anything else. So the conservative route hopefully helps you and you're able to maintain without surgery, because that's not an option that everybody wants to jump to. There's always, risks associated with any sort of surgery, right? But if you do have it, then you have a really good, strong background and strength and understanding of pressure control to have the best outcome from that surgery. From a personal experience, when I was struggling with my stress incontinence and my OB, I went to go see him for a pessary fitting, and he told me my urethra was so hypermobile, I'd never run again without leaking, which I can. But he presented me with a urethral sling option. And the things that totally missed the mark there, though, is that was the first solution for me, even though I was there pursuing a pessary and more rehab, as well as the fact that I was 5 months postpartum and still breastfeeding and not enough time to see significant change happen. So I think you just have to always see the bigger picture and consider those sort of things, as well as getting multiple opinions. I think we usually just go to one OB and then they say we need that surgery and then you go with it, right, with them. But should always get more than one opinion from a provider. I will also offer this from my other most recent experience with the cervical stuff. When I consulted with the surgeon before the cone, she sort of suggested that a lot of women just choose to go for the hysterectomy regardless of the cone results, pending that they were negative, just to alleviate future issues with it, especially if they know that they're done with having kids. And after thinking through it a little bit, I was almost there with that same sentiment of what is it affecting your emotional health like? This worry, this stress, maybe I should just consider that. So I share this because I was almost there, and before the cone, we were talking about what the different scenarios and outcomes could be and how we might address them depending on what might happen. And she said, I've tried to put myself in your shoes so many times and think through what I would do. And I also asked a bunch of my other OB-GYN colleagues, what would you do if this was like your profile of this person? And would you screen or would you go for it for the hysterectomy? And the results came back due to the screening, because they almost all resoundingly said there doesn't not come an associated increased risk of something unintended happening with that surgery. And as long as you are going to be a surgical candidate in a year or two because you're healthy, 3 years, whatever that looks like, then you still have that window to be able to do it if you want to. So those are my thoughts and wisdom and personal lived experiences in trying to navigate decisions around surgeries associated with prolapse and such. Nobody can make the decision for you. You have to learn in your own self, how it's affecting your quality of life to the extent that you want to make sure you feel good about making the decision either way. And then also those other things about like what's going on with your hormone levels. Like I was breastfeeding, or how long have you tried that for? Are you postpartum? Lots of things to consider on that end. Or are you healthy and can you give it a little bit more time? And if you still want that surgery, you'll still have that window of opportunity versus people who have other health risks sometimes only have a window of opportunity before they're less than an ideal surgical candidate. So there's a lot to consider. I don't like coming out as like an anti-surgery person. I'm just anti that as your first option and nobody discussing anything else with you about it.